Assalamu alaikum, everyone. Today we're going to understand and manage migraine in a holistic way. So, the American Migraine Prevalence and Prevention Study indicates that 43% of women and 18% of men usually have migraines, and this is greater in Western countries. So, what really is a migraine? A migraine is a complex brain event that can produce a wide array of neurological and systemic symptoms. It could be perceived as a half side or one side of the head. The pain is not necessarily one sided, though, it can affect the whole brain. And symptoms include extreme prolonged head pain, photophobia, it means you do not like the light, nausea, and vomiting. Sometimes the migraine is preceded by sensory, that's visual or motor symptoms like the aura, and more commonly, there is no aura. A migraine aura is a set of sensory disturbances that can occur during or before a migraine attack. It acts as a sign and typically lasts between 30 to 60 minutes. These disturbances can affect vision, touch, speech, or movement. Common types of migraine aura includes the visual aura, seeing flashing lights, zigzag patterns, blind spots, shimmering spots. Then there is sensory motor aura. It just means a tingling, numbness, or weakness in parts of the body. Then the third one is dysphasic aura, which means there is a lot of difficulty in speaking and forming a coherent sentence. So while migraine aura can be unsettling, it is generally not dangerous. However, its symptoms can mimic serious conditions like sometimes a stroke. It's usually thought that the cortical hypoperfusion, in simple terms, reduced blood flow to the brain, can cause a migraine attack, particularly those with the migraine aura. So, the phenomena is linked to cortical spreading depression, a wave of neuronal activity followed by suppression, which can trigger changes in the blood flow to the brain. And basically, it is a kind of effects which are the same, like we discussed before: visual disturbances, sensory changes, speech difficulties. Then all of this is mainly linked to cerebellar hypoperfusion, which just in simple terms means very less blood flow going to the brain, which can temporarily affect the brain regions, leading to symptoms like numbness, tingling, weakness. And we will discuss how to overcome these. So, there are lots of different reasons that can lead to a migraine attack. Some of the epidemiological studies suggest that migraine is associated with disorders of the cerebral, coronary, retinal, dermal, and peripheral vasculatures, that the blood vessels there, or it can also be linked with the vascular endothelial dysfunction. It's just a big word for the capillaries which are around the brain, and impaired vascular reactivity, or it can also be due to brain excitability, a kind of epileptic movement disorder or episodic movement disorder. Then the waves of altered brain function, such as cortical spreading depression, could be a reason for translating changes in cellular excitability into a migraine attack. These are just different kinds of migraines and theories which are out there. And what we do in phytotherapy, we have different herbs. If there is an epileptic brain excitability as a reason for migraine, we suggest sedative, epileptic herbs. If there is endothelial dysfunction or something to do with not proper blood flow going to the brain, then we have feverfew herbs or microvascular herbs, which explain how uh, the herbs are effective in increasing the brain circulation and blood flow to the brain. So, migraine is potentially progressive disorder, and progression could lead to chronic migraine that has a lot of other effects. So, in women, migraines have been developed during perimenopause or when there are triggering foods like cheese, coffee, chocolate, citrus fruits, alcoholic drinks, or sometimes they are positive for H. pylori, which can be 40% of the cases um, responsible for migraine. And then food allergies can play a role in migraine as well. So, cow's milk products, wheat, and eggs, which are poorly absorbed, they can cause migraine. In general, patients who are seeking phytotherapy for migraine can be sufferers of chronic migraine, and there is no harm that if they want to have some herbs such as feverfew, willow bark, ginger, cordylis, which can help in preventative herbal treatments. And so there are certain migraine herbs I've listed here. So anxiolytic and nervine tonic herbs, which reduce the effects of stress, for example, reducing cortisol levels. And then they also have analgesic activity. Analgesic just means pain relieving activity, such as cordylis, while St. John wort may be particularly effective if there is a need of increasing serotonin neurotransmitter, which is the happy hormone. And there are some anti-epileptic herbs. If there is a lot of increased activity, they can help soothe or calm those brain waves, such as kava, bacopa, withania, and valerian. So, how does feverfew work? It works as a migraine prophylactic. So, it means if before going into a major migraine attack, it would prevent that. And feverfew supplements, if you're having those, should have a good level of parthenolides in it. And the usually drugs take 3 months to show their full action. So feverfew can fully work in 4 to 6 months. It's better to stock them up if you plan to be on feverfew therapy, and it's primarily effective on platelets. So it can reduce thinness of the blood. If you are on any antiplatelet medications, then please be sure that your health practitioner knows about it and he adjusts the dose accordingly. Then other herbs antiplatelet can be ginger and turmeric too. They're anti-inflammatory too. If the migraines are related to trigger foods, then there are signs of problems with digestion, which can be solved by improving the upper digestion, the liver function. Then there are phytotherapeutic drugs which help in a liver detoxification, and they are usually called as chloradic herbs, such as artichokes. There are herbs which aid the liver detoxification from your kitchen, such as turmeric. And supplements or tinctures of Schisandra can also be found. In France, however, liver is connected by a lot of phytotherapists with the study of migraine, and a liver herb called Fumaria officinalis. It's a fumitory herb which is widely used in France. So, Fumaria actually helps with the liver and acting through other detoxification pathways too. So, it's a diuretic, it just means that promotes the flow of urine. It's a laxative, it just relieves constipation. Then it also helps with skin conditions, eczema, psoriasis, And the chemical composition is alkaloids, potassium salts, tannins, and fumaric acid, which I am hoping that helps with the migraines. So I guess this is the same thing which we have studied, fumaria officinalis, and then liver as related with the migraines. So there are different reasons of having migraines. Number one, it can be H. pylori in your stomach, and they can be treated by bitters, garlic, sage, thyme, nigella, golden seal. Bitter gourds are great examples, and nigella, black seeds, which are used in the prophetic medicine too. Then menstrual migraines are basically when the estrogen rises, so they can be treated with the estrogenic effects as shatavari, wild yam, tribulus, whereas the premenstrual migraine it can be alleviated by chaste tree or the chasteberries whitex. Then moving on to more phytotherapy, if you see ginkgo biloba, some of the beautiful brains, they have been on ginkgo, and they are those kind of brains which have um, hyper perfusion, and the blood flow is brilliant. Then brain is a bulgy fatty tissue which is seen that ginkgo really helps the all parts of the brain to get fresh oxygen. So I really recommend ginkgo and spasmodic herbs. These are herbs which particularly have an effect on circulation. So we know that circulation, blood circulation going to the brain is so important. And herbs like hawthorn, cranberry, chamomile, butterbur, they're used for migraine prophylaxis. Then butterbur is also useful where you have food allergies and in reducing the flare ups or inflammation. So I'm assuming that it would also help in neuroinflammation. Given these, there are pro inflammatory cascades involved in migraines. So, anti inflammatory herbs like boswellia, also known as Indian frankincense, loban in Arabic, turmeric, ginger, they can be a great value as preventative agents. Then herbs which promote endothelial health, which just means promote the blood vascular health, are garlic, bilberry, pine bark, grapeseed extract, ginkgo, green tea, turmeric, and Polygonum cuspidatum. I just want to highlight a little on pine bark. It contains pycnogenol, and pycnogenol is an amazing chemical which helps more blood circulation. It increases nitric oxide in the blood vessels, which dilate the blood vessels and helps a gush of blood flow through the brain. So it's really helpful in ADHD children. Then grapeseed oil is a good um, oil to use for such people who have migraines. And Polygonum cuspidatum is a source of resveratrol. Resveratrol is found in grapes when the grape meets water and you leave it for 3 days. But when fermentation starts, the grape starts turning into a wine, which is not required. So, resveratrol from grape juices, which can be made at home, are helpful in migraines. So I would suggest if you are on Tylenol and popping up aspirin like every day because of migraines, feverfew tablets, 150 milligrams, having parthenolides or boswellia, which is 200 milligrams, equivalent to dry gum raisin, 2,400 milligrams, containing boswellic acids. Then celery seed oil, um, ginger rhizome around 300 milligrams, chase tree 500 milligram tablets. These are much, much better to restore health and wellness related to any trigger food migraines or premenstrual migraines. For premenstrual, I really like the chase tree with feverfew, and in men we have seen feverfew therapy working quite nicely with avoiding cow's milk products, wheat, eggs, ice creams, and yogurt. So, this was all about migraine. Let me know if you want to know more about different types of migraines and how to enhance cognition. And so, like I said, ginkgo biloba is an amazing herb, and pycnogenol, which comes from pine bark, helps people with ADHD. And yeah, this is it. So, masalama.